Well, a warm welcome to this talk. Now, for the last few days, we've been looking at this document here, MAHA, Make America Healthy Again report, particularly about children. And this has been presented by Robert Kennedy to the President of the United States. And we've looked at this for the last 3 or 4 days now, in between visits to motorcycle rallies and graveyards, of course. Now, this is giving us fairly specific information about obesity, diabetes, cancers, asthma, allergies, autoimmune disease and behavioural disorders, depression and anxiety. And I'm going to go through some of the points in this. I'm not going to reference each individual one, but they are all well referenced in the study. So really everything that is in here is really quite well referenced. That's why I can just more or less read it out as a bedtime story, really, because if you look at it, there's 520 odd references in this report. So it really is a very thorough piece of work. So what we're thinking about today is the drivers, the etiology, that which causes disease, because there is widespread disease. And obviously the report acknowledges it's a combination of factors. Everything's a combination of genetic predispositions and environmental factors, of course. So that's fairly obvious, but they mention specifically food, chemical exposure, medications, changes in lifestyle and behaviour, physical activity or physical inactivity indeed, sleep or the lack of, and the use of technology. And some of the data on technology use is quite incredible. Now, food first of all. The food American children are eating, and by extension children all around the world or all around the developed world, what we might call the Western world, we're not that far behind in Europe or Canada or Australia. When I go to Australia, I'm actually surprised by how bad a lot of the food is. Maybe not quite as bad as the States, but we're not far behind in the United Kingdom. So we've no cause for complacency whatsoever. And things that are learned from the United States are going to apply to here, and they're going to save lives and improve the quality of lives. No question in my mind about that at all. Most American children's diets are dominated by UPFs, ultra-processed foods. Basically food made in factories rather than food generated on farms. Or the food might come from some kind of farm, but then it's jiggled around with in a factory. Lacking sufficient intake of fruits and vegetables. We want lots of fruits and vegetables. Now, some fruits, okay, are high in sugar. Most of us don't eat anything like enough vegetables, but fruits are generally good for us. Unless, of course, they're contaminated with agricultural chemicals, which is also part of the problem. But generally, they're good. In fruits and vegetables, you don't have the bioamplification of toxins, as you often do in meat products. Having said that, meat products, dairy products are good. The natural ones are good. When it's processed, it can become bad. The key concern, really, in my mind, about American meat and dairy is animal welfare. A lot of it's appalling. Get your act together, people in the United States. It's not acceptable to abuse animals. Anyway, ultra-processed food led to a depletion in essential micronutrients and dietary fibre. So it's not malnutrition is lack of some things and too much of others. And this is what we've got. Too much ultra-processed food and not enough of other essential nutrients. And as well as that, agricultural practices have depleted the soils. So people put on nitrate fertilizers, the crops grow big. But all the time, the natural chemicals in the soil are being depleted. Now, this isn't in the document, but I've made a list anyway, because these are things I think that many people throughout the world are short of. Vitamin D is an obvious one. Haven't read it so far in the report, in the bits I've studied. So vitamin D, really important. The vitamin Bs, B1 to 12, and some people need methylated vitamin Bs, so worth considering methylated vitamin B supplements. And vitamin C, I think quite a few people are low on vitamin C as well. Zinc, magnesium, selenium and iodine, I'm pretty sure people are low on these. Zinc, for example, very important for prostate health. Magnesium, very important for cardiovascular health. Selenium is an antioxidant, keeps down the free radicals. And iodine is critical for neurological development. Now, we've got a lot of neurodevelopmental problems around the world. And at the same time, people aren't getting enough iodine. In my view, the RDAs for iodine, I believe, are set way too low. And we don't eat seaweed. So in Japan, Korea, South Korea, where they eat a lot of seaweed, very often they've got plenty of iodine. There's actually not that much iodine in fish. A lot of it's in seaweed. So iodine is probably deficient. Now, severe lack of iodine causes paediatric hypothyroid disorder, what we used to call in the old days. It's not a term we would use now, of course. But the old term was cretinism. I mean, people used to be called a cretin as an insult, but cretinism is caused by paediatric hypothyroid syndrome, which is in turn, usually, nearly always, in historical context anyway, caused by lack of iodine. Omega-3s people are short of as well. We need to eat more ocean-related products. Marine phytoplankton would be good as well as fish. And also, I think quite a few people might be short of essential amino acids. Now, basically in human biology, there's 20 amino acids, 21 depending on how you look at it, but basically there's 20 common ones anyway. And 9 or 10 of those, depending again on your definition, are essential. They have to be in the diet. So if you take too much of one, if you take too much of a non-essential amino acid, you can convert that. Sorry, if you take too much of an essential acid, you can convert that into a non-essential amino acid process called transamination. But if you're short of essential amino acids, you can't make those from the non-essential ones. So again, surprisingly, protein deficiency may be more common than we think. Anyway, that's me, not the report. Let's get back to the report. Nearly 70% of America's children's calories today come from ultra-processed food. So 30% of calories that children are eating in the United States are not from ultra-processed food. I mean, this is just utterly preposterous, really. Ultra-processed food, many of which are designed to override satiety. So the idea is that when you eat a bit and think, oh, that's it, I'm full now. But this report seems to be saying that manufacturers are actually designing foods to overcome this so people eat more. I mean, surely they wouldn't do that, would they? I mean, that's bad for people, isn't it? Are these things designed to be addictive? This is potentially quite sinister things being alluded to in the report, but as I say, the report is highly referenced, designed to override satiety, being full. And 100 years ago, there was none of these. So 100% increase in 100 years. Ultra-processed foods make up 50% of the diet of pregnant and postpartum women. Again, crucial. The first 1,000 days of life is so important. And of course, that starts from when you're fertilized, when I was a fertilized zygote, when I consisted of one cell. Absolutely crucial. And indeed, maternal and paternal nutrition and avoidance of toxins before fertilization is also important. So basically, pregnant women and lactating women, 50% of their diet is coming from ultra-processed foods. That's got to have knock-on effects on the children. Now, exposure to environmental chemicals is the next one. Cumulative load of thousands of synthetic chemicals. Thousands. And they interact, they can synergize, they can potentiate, there can be all sorts of interaction between different chemicals in the body. This is well recognized in pharmacology, of course. They come from the food, they come from the water, they come from the air. And the report specifically says that these toxins include effects on neurodevelopmental and endocrine effects. Now, we are seeing, without getting into controversial areas, well, no controversy really, let's say alternative expressions of sexuality, alternative expressions of sex as expressed in the phenotype of the individual, the gender. Are some of these due to endocrine disrupting effects? It's an interesting question. I'm hoping the report gets to the bottom of that. Over 40,000 chemicals are registered for use in the United States. The potential for chemistry to interact there is immense. Pesticides, microplastic, dioxins, which we know cause cancer, commonly found in the blood and urine of children and pregnant women at some alarming levels. And of course, dioxins cause birth defects as well. I've worked in parts of areas of Cambodia where you still see effects of dioxins from Agent Orange spraying decades before. At least that's what the local doctors tell me, that they're still seeing this. Some at an alarming level. Right, children particularly vulnerable to chemicals, of course. Developing children are particularly vulnerable to things in the uterus and infancy, early childhood, and of course the other time is puberty when there's a growth spurt. Current risk assessment methods may not allow us to fully understand how these exposures affect human health, the report says. A rather nice example of understatement. Current risk assessment methods may not allow us to fully understand how these exposures affect human health. Right, pervasive use of technology. So when did all this start? The report says 40 years, I guess so, but worse in the last few years for sure. Children have transitioned from active play-based from active play-based childhood to a sedentary, technology-driven lifestyle, specifically increased screen time, reduced physical activity, psychological stressors like loneliness, chronic stress, and sleep deprivation. Blue lights at night, not good, as we know. Teens averaged nearly 9 hours of non-school screen time a day. That's incredible. Teenagers in the United States average 9 hours of non-school screen time a day. Quite incredible. Over 70% of children and 85% of teens failed to meet the 2024 federal guidelines of 60 minutes of daily moderate to vigorous physical exercise. So 70% of kids, 85% of teens simply not getting enough workout time. Nearly 80% of US high school students do not sleep at least 8 hours per night. In 2009, that was 69%, so not enough sleep. Crucial time for sleep, of course. If I had the chance when I was a teenager, I'd sleep till about 11 o'clock. I'm sure many of you were the same. 2009, 60% of high school children did not get the 8 hours sleep. Now it's 80%. This is really sad. Persistent sadness and hopelessness amongst US high school students surged between 2011 to 2021, 10-year period, from 28% to 42%. It's not, young people should not be sad. It's a joyous time of life. Well, it should be, but it isn't. Female students see as suicidal ideation went up in that same 10-year time period from 19% to 30%. 30% of high school students in the United States have had suicidal ideation. In 2024, 73% of 16 to 24-year-olds reported loneliness. Again, 73% of kids, well, no, this is not kids, this is teenagers, young adults, reported feelings of loneliness. This is a time when friendships can be so intense. You know, remember your first girlfriend or boyfriend if you're a girl, or your first the level of intensity of relationships that we had with members of the same sex. You know, people that you really felt bonded with, and now that is not there for so many people. This is really quite tragic. 73%, 16 to 24-year-olds reported loneliness. 15% of young men having no close friendships. That's terrible. Five-fold increase since 1990. 15% of young men having no close friendships. Teens using social media over 3 hours daily face double the risks of anxiety and depression. So if you use social media for 3 hours or more a day, double the risk of anxiety and depression. So you could listen to this when you're out walking in the woods, couldn't you? Just put it on your mobile phone or something. Get out there, smell some trees if you can. If you're in a city, maybe walk in the park and listen to the podcast on some headphones or something. I often do that. I listen to quite a lot of material when I'm outside walking, rather than sitting inside in front of a screen. A 2022 meta-analysis showing each additional hour increases the risk of depression by 13%. So every hour of screen time increases the risk of depression by 13%. Next point. No, this is going on, but you can listen to it in sections. The health system, this is highly medicated children, and they say it's not working. The health system has aggressively responded to these increases in childhood chronic disease with increasing rates of pharmaceutical drug prescriptions. Very often the exact thing the child doesn't need. Sometimes, of course, they do. Not knocking drugs. Very often they're overprescribed. And the report says which may cause further harm. So stimulant prescription for ADHD in the US increased 250% from 2006 to 2016. Despite evidence they did not improve outcomes, we should be prescribing drugs based on the evidence of the outcomes and how useful they are as a risk-benefit analysis. Why would we prescribe them without the benefit? Antidepressant prescriptions rates in teens increased by 1,400%. I guess that's a 14-fold increase between 1987 and 2014. Antidepressants in teenagers, not ideal. Even though a systematic overview shows that psychotherapy is just as effective as drugs in the short term, probably so is talking to your mates if they had some, and potentially more effective in the long term. Please don't think I'm knocking psychotherapy. I'm not. It's wonderful. But very often it's tragic if proper psychotherapy with proper counsellors and psychotherapists is used as a substitution for having mates. It's just, sometimes people need it for particular indications. But it should be on top of normal social interactions, not instead of. Antipsychotic prescriptions for children increased 800% between 1993 and 2009. Most of these medications prescribed for conditions not approved by the FDA for use in children. Yet they're being prescribed anyway. Studies find that more than 35%, more than 50 million prescriptions of childhood antibiotics are unnecessary. Antibiotics, of course, can be life-saving, but they have to be used correctly. And antibiotics, like any other drug, if we use too many antibiotics, for example, it'll kill a lot of the bugs in the colon, the intestinal microbiota. And we know that there's a big link now between the bugs in your gut and your brain. It's called the gut-brain axis. So amazing. The bacteria in our guts have great interactive effects with our brain and therefore our minds. If the mind is limited to the brain, I'm not saying it is. It probably isn't. Studies find more than 35%, 15 million prescriptions of necessary antibiotics. Infants exposed to antibiotics in the first 2 years of life are more likely to develop asthma, allergic rhinitis, atopic dermatitis, celiac disease, obesity and ADHD. So antibiotics given in the first 2 years of life must be given for specific indications because they increase the risk of these conditions. Next point, corporate capture and the revolving door. Perverse incentives that impact the regulatory bodies and federal agencies tasked with overseeing them. So not only is the perverse incentives for the regulatory bodies, the guys that are supposed to be keeping them in check, it sounds like they can have perverse incentives as well. The report doesn't say what those perverse incentives are. The mind boggles. Some may be carrots. Some may be sticks. Government funding has been a small proportion of the totality of research dollars being spent on chronic childhood diseases. So who the heck is researching this? Well, the majority is funded by the food, pharmaceutical and chemical, as well as interested non-governmental organisations and professional associations. So we've got people here funding this essential research who could have perverse incentives. Not a good situation. Examples. The food industry funds the bulk of research in the field. A British Medical Journal analysis found that industry spent over 60 billion on drugs, biotechnology and device research in nutritional science. $60 billion. By comparison, the government spends an estimated 1.5 billion on nutritional research. So if we assume, and it's a big assumption, that the government research is non-biased, that's $1.5 billion. Vested interest or potential vested interest with potential perverse incentives, $60 billion. And of course, because of the revolving door, can we really trust the government research? Concerningly, industry-funded nutrition research may bias conclusions in favour of sponsors' products. Wow, that's what the report said. Let me just read that again, because it definitely said that. Concerningly, industry-funded nutritional research may bias conclusions in favour of the sponsor's product. Well, get away. That's a risk, according to this report. Don't take my word for it. Read it in the report. It really is completely readable. And I think once you start reading this, you'll probably just sit and read it all, because it's you just keep going, oh, yeah. Oh, right. Okay. It just seems to click with me anyway. It seems to make sense to me. Right. Moreover, our analysis reported that 95% of the 2020 Dietary Guidelines Advisory Committee members had financial ties to the food and pharmaceutical companies. Moreover, one analysis report that 95% of the 2022 Dietary Guidelines, and of course they're up for renewal now in 2025, committee members had financial ties to the food and pharmaceutical companies. Now, of course, no one's saying that would in any way affect anything they put in the National Dietary Guidelines. But 95% is a high number. Nearly finished. The chemical manufacturing industry spent roughly 77 million on federal lobbying activities in 2024. Getting the story straight, while 60% of their lobbyists previously held federal posts. Revolving door again. More than 10,000 chemicals listed on the EPA's, that must be the Environmental Protection Agency's, inventory are designated as confidential, and generic chemical names are used to identify them. Pharmaceutical industry. 1990 to 2018 spent 4.7 billion on lobbying expenditures at the federal level. More than any other industry. 9 out of 10 of the last 10 FDA commissioners. 9 out of the last 10 FDA commissioners have gone on to work for the pharmaceutical industry. 90% of the FDA commissioners have gone on to work for the pharmaceutical industry. Now, I'm sure that none of those commissioners were thinking, you know what, I better keep my hands clean here and better not dribble on my shirt because I'll be getting a job with the pharmaceutical industry next year or the year after. I'm sure they didn't think that, but 9 out of 10 of the last FDA commissioners have gone on to work for the pharmaceutical industry. I'm sure none of them had have an eye to the future, would they? It doesn't look good though, does it? 70% of the FDA medical reviewers have gone on to work for the pharmaceutical industry. Over 80% of clinical departments and teaching hospitals in the US medical schools receive some degree of pharmaceutical funding. Half of the total cost of continuing medical education is funded by industry. 2010 and between 2010 and 2022, industry provided $6 billion to over 20,000 patient advocacy organisations. Gimme that drug, or whatever those organisations were advocating for. There you go. Yeah. Bedtime listening from that report. If you're still awake, thank you for watching. But things of major concern, impacting the health of a child, therefore impacting health for the whole lifespan of the individual and into the next generations, it has to be said. Let me know what you think. Personally, I think we need some changes. Personally, I think we need some pretty big changes. But let me know what you think. But for now, as always, thank you for watching.